is gene deletion? Gene deletion is a mutation which a part of a chromosome or a sequence of DNA is lost during DNA replication. Any number of nucleotides can be deleted, from a single base to an entire base of chromosome. The smallest single base deletion mutation are believed to occur by a single base flipping in the template DNA, followed by template DNA strand slippage within the DNA polymerase active site. What is your main topic about this gene deletion? 22q11.2 deletion syndrome has many possible signs and symptoms that can affect almost any part of the body. The features of this syndrome vary widely even among affected members of the same family. Common signs and symptoms include heart abnormalities that are often present from birth, an opening in the roof of the mouth or a cleft palate, and distinctive facial features. People with 22q11.2 deletion syndrome often experience recurrent infections caused by problems with the immune system, and some develop with arthritis and Graves' diseases in which the immune system attacks the body's own tissues and organs. Affected individuals may also have breathing problems, low levels of calcium in the blood which can result in seizures, a decrease in blood platelets or thrombocytopenia, significant feeding difficulties, gastrointestinal problems, and hearing loss. Skeletal differences are possible, including mild short stature and less frequently abnormalities of the spinal bone. What are the possible answers about this syndrome? Answers to this kind of syndrome are prevention, diagnosis, treatment, and therapy. Prevention. In some cases, 22q11.2 deletion syndrome may be passed from an affected parent to a child. If you're concerned about a family history of 22q11.2 deletion syndrome, or if you already have a child with the syndrome, you may want to consult a doctor who is specialized in genetic disorders, or the geneticist, or a genetic counselor for help in planning future pregnancies. Diagnosis. A diagnosis of 22q11.2 deletion syndrome is based primarily on a lab test that can detect the deletion chromosome. Treatment and therapy. Treatments and therapy for 22q11.2 deletion syndrome may include interventions of hyperparathyroidism, heart defects, limited thymus gland function, severe thymus dysfunction, and etc. What are the consequences of this syndrome? The consequences of this syndrome is, as a result, the disorder can cause several errors during fetal development. Common problems that occur with 22q11.2 deletion syndromes include heart defect, hyperparathyroidism, thymus gland dysfunction, cleft palate, distinct facial features, learning behavioral and mental health problems, autoimmune disorder. What are your personal opinion about this syndrome? My personal opinion is this syndrome is very serious because it's fatal. It has no cure. If you have this kind of syndrome, the patients should take precautions to avoid contracting infections associated with disease, such as truly washing their hand with soap and water. We must care for our body in order us to avoid diseases, because prevention is better than cure.